For nearly 2 years now, we've heard health officials tell us about how social distancing, hand hygiene, and putting on a mask can all help slow the spread of COVID-19.
Tonight, NBC26's Eric Kresh reports a new international study is pointing to data that details how much of a difference those measures can have.
A new report published in the British Medical Journal has compiled 2 years' worth of data from across the globe, trying to find out how effective measures like masking and socially distancing can be in slowing the spread of COVID.
Overwhelmingly, when you look at the data that may not be the best quality always, it points in the same direction that these things do work, and they never harm, they never increase the risk of transmission.
Ajay Sethi is an associate professor of population health sciences at UW-Madison. He says from the beginning of the pandemic, professionals in his field were confident that face masks and socially distancing were key to stopping COVID spread. Unfortunately, many can only endure mandates for so long.
Communities that have adopted it, these kinds of restrictions tend to fare better, but unfortunately, it's very hard to maintain those kinds of restrictions for a long period of time because people get fatigued.
But according to new data, those who endure the fatigue of the pandemic and mask up regularly contract COVID about 53% less often than those who go without masks.
When our community makes progress, we made progress because people took precautions.
Additionally, the study, which included nearly 400,000 people from about 200 countries, found that in places with mask mandates, they have about 46% fewer COVID-19 related deaths.
A policy is only as strong as it's followed.
And while numbers will never be able to tell the whole story of how this pandemic has impacted the world, this new data helps reinforce a message that has been shared and debated for almost 2 years strong.
Wearing masks, keeping distance, and hand washing will remain important from this point forward. But the vaccine really was a game changer when it became authorized for use.
In Wisconsin, Eric Kresh, NBC 26.